Good morning, everyone. Today, we are going to explore a concept that lies at the heart of modern health service planning, market segmentation, and how it can be thoughtfully applied within sexual and reproductive health, or SRH. As we move through the lecture, you will see how segmentation helps us respond to the diversity of needs across different groups, allowing SRH services to become more efficient, more equitable, and more patient-centered. To build that foundation, let's begin by clarifying what segmentation actually means when applied to healthcare. Market segmentation is essentially the process of taking a broad, diverse population and dividing it into smaller, more similar subgroups. Groups that share meaningful characteristics such as age, behavior, attitudes, or specific health needs. In SRH, this means we stop treating all patients as one undifferentiated group. Instead, we ask, who exactly are we serving, and what does each group truly need? For example, adolescents may seek confidential and stigma-free contraception. Couples managing infertility may require specialized and emotionally sensitive care. High-risk populations may need targeted, risk-appropriate STI prevention. This shift from generalization to specificity is what enables SRH services to respond effectively. Now that we have a working definition, the question becomes, why is segmentation so essential in healthcare? Segmentation strengthens healthcare delivery in several important ways. Diverse needs. SRH needs differ across the life course. Someone trying to prevent pregnancy has very different priorities than someone trying to conceive. Recognizing these differences leads to more meaningful care. Customization. Segmentation encourages the development of specialized services, use-friendly clinics, discrete counseling options, or tailored fertility programs, making care more relevant to each group. Resource efficiency. Because SRH services operate under limited resources, segmentation helps identify who needs which services most urgently, ensuring interventions are targeted and strategic. With these motivations in mind, we can start to appreciate the practical advantages segmentation brings to SRH organizations. Segmentation offers several tangible benefits. Improved engagement. People respond better when messages reflect their lived experiences. A culturally aligned family planning message, for instance, is more likely to inspire trust and action. Enhanced quality of care. When services are designed around users, whether that means flexible scheduling for young adults or culturally sensitive infertility counseling, patients feel more supported and are more likely to adhere to care plans. Cost efficiency. Rather than using broad, unfocused outreach, segmentation ensures resources are deployed where they will be most effective. Competitive advantage. Organizations that develop expertise in serving specific groups, such as adolescents or LGBTQ+ clients, often become recognized leaders in those areas. To understand how these benefits are achieved, we now turn to the core building blocks of segmentation. To create meaningful segments, organizations generally draw on four major categories: demographic, geographic, behavioral, and psychographic. Each lens helps highlight different characteristics of the population. Let's begin with the most familiar: demographic segmentation. Demographic segmentation relies on measurable population traits and plays a central role in SRH planning. Age. Ages 15 to 24 focus on STI prevention, confidential contraceptive access, and supportive counseling. Ages 30 to 40, emphasis shifts toward fertility services, prenatal care, and long-term reproductive planning. Income. Lower income groups may rely on subsidized or publicly funded services, while higher income clients may seek premium offerings like elective egg freezing. Education. Health literacy varies across educational levels. Some clients benefit from detailed, technical explanations, while others respond better to simplified and visual materials. Now that we understand who we serve demographically, we turn to where these clients live and how place shapes access. Geography profoundly influences SRH access and service design. Urban versus rural. Rural communities may experience limited access, sometimes referred to as contraceptive deserts. Mobile clinics, outreach programs, or telehealth become essential solutions. Legal landscape. Different regions have varying laws regarding reproductive rights. These policies shape service availability and influence how organizations must tailor their outreach. Proximity to facilities. Clinics may prioritize populations within a specific radius to optimize appointment availability and transportation support. Understanding location provides context, but we also need to consider how people behave in relation to their health, which leads us to behavioral segmentation. Behavioral segmentation examines knowledge, attitudes, and actions related to SRH. Using HIV prevention as an example, responsive individuals. They recognize their risk and feel capable of taking preventative action. They respond well to easy access and timely reminders. Avoidant individuals. They acknowledge risk but feel unable to act. Empowerment-focused counseling is critical for this group. Indifferent individuals. They do not perceive themselves at risk and lack motivation. Education and awareness campaigns are essential here. These behavioral differences guide how SRH messages are framed and delivered. With behaviors in mind, we now shift to segmentation based on health conditions themselves. Health status also creates distinct SRH segments. Chronic management. Patients with long-term conditions such as PCOS or endometriosis require consistent follow-up and tailored care plans. Acute needs. Clients seeking emergency contraception or STI treatment need fast and barrier-free access. Preventative care. Healthy individuals come for routine screenings or family planning counseling. Understanding these needs helps facilities allocate staff and resources effectively. Next, we consider how financial factors influence segmentation. Payment mechanisms play a major role in shaping SRH services. Public payers, such as Medicaid, coverage focuses on essential services with often strict formularies. Clinics must ensure affordability while meeting program requirements. Private insurance. These plans typically support a wider range of elective or advanced procedures such as IVF. Out-of-pocket clients. Price sensitivity is high. Clear and transparent pricing builds trust and encourages service use. Finances influence access, but so does technology, especially in today's digital age. Technology preferences differ widely among SRH clients. Digital natives. Younger clients often prefer app-based scheduling, teleconsultations, and automated reminders. Convenience and privacy are key. Traditionalists. Older clients may be more comfortable with in-person visits and paper-based communication. Personal interaction is important. Because of these differences, many SRH programs adopt a hybrid model that balances digital tools with face-to-face care. Technology, in turn, interacts closely with cultural identity, a crucial dimension of segmentation. Culture shapes perceptions, beliefs, and decisions in SRH. Language access. Providing materials in the languages clients speak is foundational for inclusion. Culturally informed care. Recognizing cultural values around contraception, fertility, or sexual health fosters trust and improves adherence. Community engagement. Partnering with trusted local leaders or organizations can reduce stigma and create safe entry points into SRH services.
With these segmentation tools, we can look at how programs apply them in real-world scenarios. Segmentation becomes powerful when translated into targeted interventions. Preventative care, self-screeners. Segment, health-conscious mothers. Focus, menopause and cancer screening. Channels, community centers and newsletters. Maternity services. Segment, expectant mothers. Focus, prenatal nutrition and childbirth preparation. Channels, parenting apps and online groups. Adolescent health. Segment, youth aged 15 to 19. Focus, safe sex and STI prevention. Channels, TikTok, school programs, and peer educators. Although highly effective, segmentation also presents important challenges. Several issues must be addressed. Ethical concerns. SRH data is deeply personal. Strict privacy protocols are essential to protect clients from harm. Data gaps. Traditional demographic tools may overlook marginalized groups, such as non-binary individuals. Segment fluidity. SRH needs change over time. Someone seeking contraception today may seek pregnancy support next year. These considerations remind us that segmentation must be flexible, ethical, and continuously updated. Finally, SRH segmentation occurs within a constantly shifting environment. Policy changes, legal decisions, can rapidly reshape access and demand, requiring organizations to reassess their strategies. Evolving social norms. Greater openness around menstruation, infertility, and menopause is expanding SRH service opportunities. Future outlook. Because needs and environments continue to evolve, SRH programs must regularly evaluate and refine their segmentation models to stay relevant and equitable.